well so far. And hopefully we will have a very efficient meeting in the coming minutes. So hopefully everyone has had an opportunity to look over the agenda and the minutes. So we'll start with the agenda. If there are no additions or modifications to the agenda, we'll go ahead and entertain a motion to accept the agenda as published.
Motion.
So moved.
All right, so it's been moved and properly seconded. Do we have any debate? All right, Rosalind, I think we're ready for the question.
Okay. Dr. McDougall,
Yes.
Dr. Wright,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Commissioner Long,
Yes.
and Anthony is not going to be with us this afternoon. So thank you.
All right, thank you.
Hey, Rosalind,
Yes, ma'am.
you didn't call my name. I don't
I
think.
didn't, Dr. Jackson.
No,
Oh,
ma'am.
sorry. I apologize, Dr. Jackson.
Yes.
I definitely said it in my head. Thank you.
All right. So the agenda approval has passed. We're going to move on to the approval of the minutes from the January meeting. Again, hopefully everyone's had an opportunity to review those. If there are any additions or corrections, I'll entertain those at this time. If not, I'll entertain a motion to accept.
So
Motion
moved.
to accept. Seconded.
All right, it's been moved and properly seconded. If there's no debate, we're ready for the vote.
Who second?
Dr. Ray and I think Dr. Ray seconded. Was it Dr.
Okay.
Orto that?
No, it was somebody else.
Yeah,
Okay.
it was me. It was me, Rosemary, but somebody else. We
Right.
said it at the same time.
Okay,
Okay.
that's fine. I got it. Thank you. All right, Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
Dr. Glover,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller. Thank you.
Thank you. Rosalind, have you received any submissions for public comments for this evening?
No, sir.
Very good. All right, so we're going to move on to the next item on the agenda, item 5, staff and program recognitions. Director Jenkins, you have the floor, sir.
Thank you very much, Mr. Chair, and to this great board, I just say good evening. Just want to really lift up our preparedness coordinator, Mr. Corey Morris. He has appeared before this board before, but I just really want to really recognize him and just kind of give a small detail. Upon taking the health directorship in 2020, Corey Morris, who hails from environmental health as a registered environmental health specialist, was one who was interested in preparedness. And little did I know that our preparedness coordinator at the time was set to retire as COVID was upon us. But since that time, Mr. Morris has done a fantastic job, has a great attitude and a passion for preparedness. There's nothing that the team can ask him that he would not do for us and for Durham County. And it also extends, his relationship extends to County Office of Emergency Services as well as being a good player with them. So just want to really lift him up and just let this board know how valued he is to our team and to our overall community. And we're grateful for his contributions. That is all I have, sir.
All right, very good, very good. All right, we'll move on. Then our first presentation or administrative report will be given by Micah Gendon, with our second quarter fiscal overview. Micah, you have the floor.
Thank you. Good evening, everybody.
Good evening.
Can you see my screen?
Yes, ma'am.
Fantastic. All right. Wonderful to be with you all again. I am, as Dr. McDougall mentioned, going to share our Q2 fiscal report this evening. We'll start with our budget. So our original budget for the fiscal year is $28,966,535. The opioid harm reduction budget amendment from November, that was $324,500, is included now in our original budget numbers since the opioid settlement account has been established by the county. Additionally, our year-to-date amendments are $2,478,803, making our current budget $31,445,338. As I share the following slides, I want to give a shout out to my awesome colleague, JP Zeta. He's from our population health team, which is led by Marissa Mortaboy. JP is a data scientist for the department and a Power BI whiz, and we have recently collaborated on the creation of a fiscal dashboard. So the graphs and charts that you'll see in tonight's presentation are taken from the new dashboard, and we're both very excited to have them see the light of day with you all. So regarding our expenditures through Q2, DPH has spent $25.82 million, or 47% of our yearly budget. This number includes funds that are encumbered for contracting that will carry us through the end of the fiscal year. It also includes employee benefits that are housed in the county's benefit fund. Since the beginning of the fiscal year, our expenditure authorization has increased 16.5%. Due to the various grants and awards received by divisions across the agency. This graph shows the percent of budget used by the top 10 divisions with the highest budget. So the percent spent is along the side here, the y-axis, and a rough estimate of the expenditure budget is across the bottom, the x-axis. So using this chart, you can see that, for example, dental has spent 57% of their budget. Immunization has spent about 56% of their expenditure budget here. Dine has spent 48%, admin 52%, etc. So these figures also include the funds earmarked for contracts through the remainder of the year. Here we have our highest expenditures by month and line item name. So I noticed that December salary was lower than in previous months by about $234,000. So when I looked into that, I discovered that the pay period that covers December 11th through December 24th was paid in January 5th. So most of that December amount will be hitting in January, not December. Our insurance amount here is taken out by risk management, taken out of our account by risk management one time per year, and that occurred in December. Also in December, the lab had some equipment calibrated and purchased several sets of blind samples, both that show here in maintenance and repair equipment. And additionally, dental purchased a machine that get rid of plaque and tartar, and that is hitting here in non-capital maintenance and equipment. As we look at this fiscal year versus last fiscal year, we see that our personnel costs are slightly higher this year due to the class and compensation changes that were made at the county level for fiscal year 24. We are spending less on contracts than this year than last year at this time. This is mainly due to a lag in receiving some invoices from a couple of our larger vendors. in the most timely fashion, as well as a decrease in our COVID funding from last year to this year. And that was largely used for contracting from the previous few years through COVID. Our changes in our supply costs look small on this graph, and they are much less dramatic than these other areas, but we are seeing an increase due in part to inflation as well as post-COVID demand. The next 4 slides are about revenue. So through Q2, DPH has collected $5.9 million in revenue, or 43% of our yearly budget. And since the beginning of the fiscal year, our expected revenue has increased by 40% due to the same grants and awards that we've received in various sections of the agency. Here we have our revenue generated by source with the usual suspects, Medicaid and grant revenue here at the top. We received our yearly Medicaid cost settlement award of $1,723,230 in December. And when we look at this, this is a sales Pareto chart, we can see that Medicaid makes up 54% of our revenue. And then when we add in our grant revenue, that accounts for 94% of all of our agency revenue. So thanks to all those divisions who put in the hard work to write and win the awards and administer and monitor their grants, as well as everyone working to maximize our Medicaid revenue. There's their hard work paying off here. Here we've got revenue pulled by our cost centers, and you can see which months so far this fiscal year have had the most revenue activity. The top 6 cost centers are the same as they were that I shared with you in Q1. And when we look at a few of those, the 62% in administration in December is the Medicaid cost settlement that I spoke of. The 66% in health education in September is a Bull City Strong grant payment from the federal government. And the 60% in Dine here in November was also a federal grant payment that came in. Those come in large chunks. So lastly, comparing revenue received this fiscal year to last fiscal year at this time, in most of our cost centers, we pulled more last year at this time, but in family planning and dental, we are seeing the opposite trend. I think that this is mainly due to how our Medicaid payments are coming into the agency now from the PHPs, and we are working now on a new system to get that revenue coded to the divisions. Also affecting this, I believe, is we have fewer COVID-related grants this year than we have in previous years, so that's going to make a difference on this chart as well. And with that, I thank you all, as always, for your leadership in regards to the fiscal matters, and I'm happy to take any questions that you all may have.
Any questions? All right. Well, I want to thank you, Micah, for you and your team's excellent work and the great presentation. Thank you for all of that wonderful information.
Absolutely. Thank you.
Absolutely. All right. So we're going to move on now to our reports. We have our health vacancy report. Looks fairly standard again, but I will give the floor to Director Jenkins if he wants to make any comments.
Thank you, Mr. Chair. I'll just say 2024 is starting off pretty well. I did say to the leadership team, and it was worth repeating, that that's normally a time of reflection, and we tend to see a lot of resignations, but we just simply have not seen that, which is indicative of this great place that we work in for Durham County. it's noteworthy to indicate to you all that in December, the vacancy percentage was about 16.6%, and now it's right at about 15.3%. So we are hopeful that we're on a positive trend. I also will say to this board that we have been very successful under the leadership of Director of Nursing Kiki Rayner and Deputy Health Director Liz Stevens to have filled some key nursing positions, and certainly want to give them their kudos while I'm able to do so. But otherwise, things are looking up as far as vacancies.
That's awesome. Yeah, I know. Notice that the vacancies are down slightly, and it's always good to hear that we're building up that nursing core.
Indeed, but
So valuable to us.
we won't smile too much because we do know that we have some retirements pending.
Coming. Okay. All righty. Well, we'll take the win when we can get it, right?
Indeed.
All right. So our next report is our NOV report for February. I see Mr. Salter is on the call if he would like to make any comments about the progress we're making there. I'll give the floor to you, sir. You're off mute, but I can't hear you.
Yep. I don't hear him either.
He's getting his headset on.
Oh.
That's gonna solve the problem.
Chris, go ahead and hit.
And-
You're still
unmute
you're still
now.
on mute.
Okay,
There you
how
go.
about now?
We got you
Yes,
now.
sir. You're good.
Apologize for that. I have intermittent problems with this and I thought we had it fixed. Anyway, we just had one additional NOV for the month of January. There is some, if you notice line 11, there's some verbiage there about an homeowner who we've had some, this one's been an interesting case to deal with. And we're going to have to get county legal involved with this one. Unfortunately, there is a message there where the person requested assistance, financial assistance, which, you know, we still don't have anything in place on a county level to do that. But this person has already had a septic installer out to help identify what the problems are. And then after they did the work, they refused to pay them. So it's a situation that we, you know, unfortunately it's not a good one. And this one could drag out for a little bit longer. It's been on there since last October. So that's it for the NOV report, I guess, unless there are any questions.
No questions here. I don't.
I have one question.
There. Go ahead, Commissioner Alon.
So is this a residential property?
Yes.
Or so a residential property had a septic issue that they needed to repair, and so they didn't pay their contractor. I'm confused. How did the public health department get involved with like this?
Commissioner, you know that we in environmental health, one of the things we're responsible for is evaluating properties and issuing septic permits for properties that aren't connected to municipal sewer. And when a system fails, and typically that's going to be what we refer to as surfacing, when you have sewage coming up onto the surface of the ground, that is against the law, and we issue an NOV. And then we try to work with the homeowner. That NOV is really supposed to be taken care of within 30 days, but that's an impossible task given the situation we are in today with all the building and the installs that are going on. It's impossible to get an installer out there in that short period of time. Plus, sometimes it takes a good while to figure out what's actually wrong with the system, and maybe it can be repaired, maybe it can't. And in this situation, part of identifying what the problem was getting someone out there with some heavy equipment to dig part of the system up to identify the problem And after that, the installer said that they refused to pay.
Okay, that's helpful. Yeah, I was more so wondering like the county's then responsibility with like the payments. Obviously, it's the unfortunate situation, but just wondering more. And I guess I could talk to Attorney Massey about that, or like how the county gets involved with the payment issue.
Well, there's currently no program in place through the county. Some counties do have, and we have proposed a program, you know, more of a assistance program, not the county paying for everything, but based on someone's financial situation, you know, it could be adjusted like lots of other programs that are out there, but we've never been able to get it pushed all the way through. There was a presentation last year, I believe, explaining, you know, or going over a program that we proposed, and we can provide you with that information if you would like to have that.
That would be great. Yeah. And also, what area of Durham is this in? Like the southeast area where we've been hearing a lot of septic tank issues due to the development, like blastings and
No,
such,
no. This is not impacted by the development at all.
Okay.
Yeah.
Thank you for that clarification. Thank you.
You're
That's all I had.
You're welcome.
All right, any other questions regarding our NOV report? All right, thank you, Mr. Salter. Thank you, Chair Alam, for your question. We're going to move on to our Health Director's report.
Thank you, Mr. Chair. And
Yes, sir.
this month, of course, we provide you with a very robust Health Director's report to the tune of almost 60 pages. The majority of that, of course, was our most excellent DINE program's annual report, and lots of good information. I feel as if I can't really thank them or applaud them enough, but that's a well-run, very, very dedicated bunch that does a lot of great work inside the community, not just the schools, but they do a whole lot of, you know, a whole lot within just festivals, you name it, they run the gamut. But for the purposes of this report, I just want to lift up two things for the sake of time. One of the things that public health does that doesn't get a whole lot of attention is shelters. And as I spoke about our emergency preparedness coordinator, Corey Morris, that is one of the things in tow with our director of nursing and public health staff overall. That's one of our many responsibilities. And the month of January, on relatively short notice, we were required to really stand up some shelters, and one shelter due to the extreme weather. And I just wanted the board to really be able to read up and to really understand that that's at times a Herculean event, if you will. But they did a masterful job of just really being able to stand it up rather quickly. And although we didn't get a whole onslaught of people, I think it was roughly about 4 to 6 people. But nevertheless, you know, we made comfort available to them when their power was out. So I definitely wanted to really speak on that. And then, of course, our population health division, one of our project managers, Antrell Branch Thomas, really did a good job with our public health wins survey. This was done back in 2022, and it really endeavors to really take a deep dive into the workforce by surveying the workforce. We had about a 44% penetration rate as far as survey participants, but the most important thing come out of it is the data, as well as in as much as us being able to really ascertain how our staff feels about, you know, the work they do, burnout, things that we can do to keep them. So I'm proud to say that public health has engaged in a lot of the activities that were recommended, but it is equally enlightening to know that over 80% of our staff still feels as if they're in the right place, they're doing the right work, and they want to continue to do this public health work. So again, I just wanted to lift those two things up in the Health Director report. Lots of good reading this month, but happy to answer any questions you may have.
Yeah, I had one question, and it's really I don't know if I don't see Corey Morris on the call, but I might be
We'll
overlooking.
try to answer for you.
Okay, so in the discussion about the emergency shelter, you mentioned that one of the challenges that was cited was the responders stated that there were some improvements that could have been made in communications. Can you give any specific examples of some of those communications shortfalls?
More than happy to, and I'll just I'll make a statement and then I'll just certainly call on our director of nursing or any Kiki Rayner, because she was certainly boots on the ground. But again, with communication, it's more or less like us really getting the call or being able to know in advance what is needed. We tend to do things in advance and try to be as responsive as we can. And there were also communication issues from department to department. So be it general services to public health to the Department of Social Services, Department of Social Services to the Office of Emergency Services. So again, whenever you have an emergency event, it's never going to be perfect. And if there's not necessarily a command structure in place where we stand up what we call an EOC, then there's the opportunities for, lapse in communications. But all learning experiences, learning events. And again, I'll just defer to Kiki if she had any other commentary.
Good afternoon, everyone. I do not. You said it all in a nutshell. We're just striving to be better and just keep improving. Thank you.
Thank you, Kiki.
Thank you both. And not really not a question at all, really just a comment and just to pile on with the kudos with the great work that the entire department is doing, but particularly I was impressed with the work that's being done by the FANFA committee, and of course Diane is a powerhouse there, always doing great work. So kudos to everyone, but particularly those two divisions.
Just a quick follow-up, Director Jenkins, on your comment about the communication, and this is just from my own understanding. This was due to the electrical outage, correct? So that was it essentially there wasn't a command center set up because of just the uniqueness of this incident, and we weren't sure how long it was going to last and what was needed, as opposed to a predictable event more like a winter storm or something like that, where that would command center would typically be set up.
That is exactly the case, Dr. Ray. There was a whole lot of uncertainty as to whether or not we needed to set up a shelter. And I think sort of at a last minute decision it was made, and the team responded in kind and just made it happen. So again, very proud of the team, but communication has been a lot better.
Got it. Completely understood. That was an extremely unique and unfortunate situation.
Indeed. Just glad that we could have been there to help.
Very good. Very good. All right. Any other questions regarding our director's report? Okay, we're going to move on. We're moving nicely here today. We don't have any old business on the agenda, but we do have 3 budget amendments. So once again, I'll give the floor to our director to present those amendments.
Mr. Chair, if I may, not necessarily old business that made the agenda, but I wasn't able to really respond via email to the board. So wanted to report back on something that Chair Alam requested, which was information about behavioral health and lots of money possibly coming to Durham as a result of the vice presidential visit last month in which she was in attendance. I did find out that it's $12 million that is coming to the state of North Carolina that's coming statewide. I also found out that they have not necessarily firmed up that funding allocation that is going to really indicate how much is going to whatever counties, if you will, but that's still pending. But $12 million for behavioral health always helps, especially given the fact that the tailored plans from DHHS and the LMEs are still being firmed up. And that's going to provide a whole lot of support and resources to those who are most vulnerable. But certainly wanted to follow up, slightly old business, and wanted to make sure I looked into that for our Chair Law.
Thank you.
Going into the new business, we have 3 budget amendments and a ratification for the board's consideration. The first of which is the board is requested to approve budget ordinance to recognize funds in the amount of $30,000 from Guilford County. These funds are intended to be used to offer training and professional development to staff, which certainly warms my heart. And Guilford County serves as our lead for our Region 5 ARPA Public Health Workforce Development Grant. And again, these funds are welcome. Particularly, I know myself and Finance Administrator Gwendon was really happy to find out that we're going to have this extra money for staff training and professional development. The second of which is a budget request. The board's request to approve budget ordinance to recognize $1,000 from Dr. Nadine Barrett. And this is going to be awarded to the Men's Health Council. We're certainly grateful for Dr. Barrett. There was just most recently a very nice going away ceremony as she is heading away from Durham. And I guess as a parting gift, she gave us some money. So again, the Men's Health Council, particularly those of you who been able to participate on the monthly Men's on the Move. I know Chair McDougall is an active participant, but we encourage you to do that under the leadership of Ms. Joyce Page, who does a fantastic job.
Awesome.
And
job.
finally, as far as budget amendments, we do have the board being requested to approve and recognize funds in the amount of $150,000 from the Department of Health and Human Services Division of Public Health Women, Infant, and Community Wellness section. And this is for additional funding for supporting women's health services in the Durham County Department of Public Health. We are delighted to receive these funds, and it was a group effort that applied for these funds. And these funds are going to be used to really increase contraceptive access and/or improve maternal and infant health for underserved, uninsured, or medically indigent patients. So we have those 3 budget amendments. And last but not least, as far as ratification, each year, the North Carolina Division of Public Health, Women's and Children's Health Section updates our sliding fee scale based upon changes to the federal poverty level. These guidelines use family size and income to determine if a patient is eligible to receive health services at a discount. And that is the reason why this is before this board. Mr. Chair, that concludes all the budget amendments and that ratification for the board's pleasure.
Thank you, Director Jenkins. So I will entertain a motion first to accept the 3 budget amendments.
So
Motion,
moved.
All right.
seconded.
You got that, Rosalind?
I did.
All right.
We do it as a team, Rosalind. You
I
can just pick
know.
whoever.
Yeah. I love it. I love it. All right. If there's no debate, we're ready for the vote.
Dr. McDougall,
Yes, ma'am.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller. And see, he's on there. Dr. Orto,
Yes.
Mr. Brown,
Yes.
and Dr. Glover.
Yes.
Thank you.
Thank you. And then we'll address the approval of the budget ratifications of the sliding fee scale for this fiscal year. I'll entertain a motion to accept that adjustment.
Motion.
Second.
All right, it has been moved and properly seconded. If there's no debate, we'll be ready for the vote.
Dr. McDougall,
Yes.
Dr. Ray,
Yes.
Commissioner Alam,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Orto,
Yes.
Mr. Brown,
Yes.
and Dr. Glover.
Yes.
Thank you.
Thank you. Thank you. Well, we are we're at the end here. Do we have any informal discussion for this evening? And does anyone have anything that they would like to see added to the agenda for next month? All right. All right. Well, we'll let the health director and his staff put together an agenda for us. Well,
Excuse me,
go ahead.
Chair McDougall.
Yes, ma'am.
Dr. Glover, did you not have something that you wanted to speak
Yes,
on?
ma'am. I wanted to figure out how to do this. I guess this is the appropriate time. Thank you so much. I wanted to know what we're doing in regard